Hi, this is Neil Versel of MedCity News at the ATA 2016 meeting in Minneapolis. I'm joined now by Kristi Henderson, who runs the telehealth programs for the Texas Ministries of Ascension Health, which includes Seton Healthcare and Providence in Waco, Texas.
That's right.
So you just moved over to Austin from Mississippi, where you had run telehealth for the University of Mississippi Medical Center for several years, and essentially build a statewide rural telemedicine network in a state that is badly in need of specialists in rural areas.
That's right. Yeah, and what's interesting is that I built that in Mississippi because of the lack of access to health care. And so it was around a shortage of healthcare providers in rural areas. But even though I'm now in an urban area in Austin, the challenges around access are the same. So it's fascinating to see why there's such different contexts, the need is still the same in both locations.
Yeah. So you then are working on, well, obviously Texas is a vast place with lots of rural areas, and then outside the big cities, you run into the same access problems.
Absolutely. There's a much larger area and territory to cover than I dealt with in Mississippi, but the technology doesn't matter if you're 5 miles away or 300 miles away. That's the beauty of it.
Right. Okay. So a little bit about your background in telemedicine. What drew you to it, and what sort of got you on this track where now it's your passion and your livelihood?
Yeah, no, it is definitely my passion. And I'll tell you that I started this, I was running an emergency department at the medical center in Mississippi.
Now you're a nurse.
That's right. I'm a nurse and a nurse practitioner. And so when I was running the emergency department, the chairman of that department and I realized we couldn't address all the challenges in the rural areas unless we were bringing healthcare to people instead of having people come to us. And so we built it around that, and really it was really a side job, really trying to address a specific problem, but it worked, and then we started expanding to other specialties and continued to grow it to where now I know it works, I know it saves money, I know it improves health, I know it uses our resources in a better way, so it's almost, why wouldn't we do it? And so I came to Texas to really have a bigger platform to be able to replicate it, because I knew it was just not fair for people not to have the access to healthcare that they need, and we can provide the solution.
Yeah, and Texas has one of the highest uninsured rates in the country.
That's right. And that's really, when we start looking at it around a capitated model, it really, in a value model, I can take care of somebody and deliver the care they need for a lower cost. And so if we have a larger uninsured population, we still have less loss in the system by using the more efficient tools.
Right. Okay. What surprised you when you moved over to Texas? Was there anything about the situation that you moved into that surprised you or maybe excited you about?
I would say it was more excitement.
Okay.
The one unexpected was the traffic.
Sure.
It's a parking lot on
well,
the highway.
Austin has grown so fast that
I think it's now become the fastest growing country and the 11th most populated city in the country now. So that surprised me. But the most exciting part, and the reason I decided to come, was because of the opportunity with the tech community, the consumer engagement, and they want a voice at the table of how healthcare should be delivered. But there's a new medical school and a new hospital, and so everything about healthcare is being redesigned, so the appetite is perfect for this to be put in place.
So you might as well start when you're building something new, get it in there, make it part of the routine, because once a routine is set, you know how hard it is to change in medicine.
It doesn't change.
Right.
And so the curriculum in our medical school with UT and Seton is going to be a completely different curriculum. And so this is an opportunity to even educate differently and use the technology.
Oh, yeah.
So it's going to be radically different, and I am excited about the future and the possibility for others to come to this destination of how healthcare should be delivered, where we're using technology every day in every kind of facet you can think of.
So are you seeing yourself as a way to, not just for medical students, but for other health systems to learn from some of the work you did? I mean, you've been doing this a long time in telemedicine.
Yeah, and what's interesting is in Mississippi, I did it, and we didn't have a whole lot of money or a whole lot of resources. I have more resources and more access to partners in Austin. And so, yes, our plan is to redesign this, show the value, the outcomes, and let other people learn from us and replicate it across the world.
Okay. What would you like to accomplish when we get together at ATA 2017? What would you like to see accomplished, maybe either personally, professionally or, for the greater telemedicine world?
I think that my goal for next year is really to make this more about a user experience.
Uh-huh.
And so I don't want to say that loosely because
Yeah.
that can sometimes just be glazed over. But this is really about redesigning healthcare to be consumer friendly. And it's happened in every other industry. And so I want to be able to know how much healthcare is going to cost, where I can get it, and I want it delivered when I want it and where I need it. And so
And you're speaking from a patient's perspective.
correct.
There. Yeah.
And so I want to build a model that I would want for me and my family, and one that consumers I think will resonate with.
Yeah.
So having them at the table to help us design something instead of having a hassle maze of healthcare decisions to try to navigate through, we want it at your fingertips.
Okay.
And so that's what I want to see, a more user-focused, convenient workflow that really makes sense in somebody's life. And I think we'll see that next year.
Okay. All right. Well, thank you. I'm speaking with Kristi Henderson from the Texas Ministry of Ascension Healthcare.
Yes.
Thank you very much.
Thank you.